You feel bloated after almost every meal. Your bowel movement is irregular, sometimes fine, sometimes not for 3 days. You get cravings that feel completely out of your control, especially for sugar or processed food. You probably treat all these symptoms as a separate problem, a different remedy for bloating, a different one for the constipation, and maybe willpower for the cravings. But here is the thing, these are not three different problems. It's a single problem which is showing up in three different ways, and that problem is in your gut, and that's your gut microbiome lining. So today I'm going to explain you what the gut microbiome actually is and how its dysbiosis can produce every one of these symptoms, and why most gut interventions fail in such symptoms. So, in functional Ayurveda, we do not treat symptoms, we trace symptoms backward to the system that generated these symptoms. Bloating, constipation, irregular bowel movements, uncontrollable cravings, poor digestion, these are not random, they are the gut's earliest warning signals, and this matters beyond just the comfort, because the gut microbiome is the root of every other axis in the body: your skin, your hormones, your brain, your immune system, your energy. When the microbiome lining breaks down here first in the gut, you will feel it, but if it is not addressed at the root, it will eventually start showing up as a chronic fatigue, maybe hormonal disruption, brain fog, maybe compromised immunity. And these early gut symptoms are actually the signs that is telling you that something is off before it is going to be comparatively difficult to reverse. So always understand the root cause of such symptoms. Now, so what is the gut microbiome actually? Let us understand that. It is a living ecosystem of approximately 38 trillion microbiomes, bacteria, fungi, viruses that live primarily in the large intestine. Now, they are not passengers, they are workers. They produce enzymes that break down food that we eat in the intestine. It actually gets processed in a way where the digestive system would produce the nutrients. So they manufacture vitamins, B12, K2, folates that your cells depend on. They produce short chain fatty acids, especially butyrate, that literally fuel the cell linings in the gut wall and regulate the inflammation. Now, when this ecosystem is diverse, well fed, and balanced, the digestion is smooth, absorption is efficient and regulated, and the cravings are also not there, and the gut wall is intact. Now, when it is disrupted through maybe a lot of antibiotic use, again processed foods, chronic stress, poor sleep, environmental toxins, the ecosystem also gets collapsed, and there are more than 1 kg in the weight of microbiomes that live in our intestines. So that is something which we all have to take care of. Ayurveda described this long before research existed. The concept of Agni, your digestive fire, maps precisely onto what we now understand about the microbiome. So, as we all understood that gut microbiomes are workers, right? Now, in Ayurveda, we call it Agni, that digestive system is a working system to digest your food. So, now these workers are in trillions, they are present. So, start identifying them, start talking to them, and start understanding their behavior. Now, how would you do that? I'll give you certain root causes here. Now, first of all, whenever you have a good hunger, your digestion is good, that means that maybe the gut lining, the microbiomes are working well. Now, sometimes if there is kind of a infection which happens when you eat outside food, or when there is some kind of a gastritis or loose motions, gastroenteritis where you get vomiting and loose motions together. What happens? Actually, there is a bad bacteria or maybe viruses which enters in the system, and sometimes what we do is that we take the antibiotics for it, and there we kill all the gut microbiomes in the gut lining. Or otherwise, if there is some kind of other infection, if there is some surgery being done, or maybe someone gets the fever and the doctor is prescribing the antibiotics, now that antibiotic medicine would not know that what are the good gut microbiomes and what are the bad ones in your gut. It is going to kill everything which is there in the gut. What does that mean? It means that you have to make sure that if you have to take antibiotic, you are taking care of your gut microbiomes later by doing your probiotics and postbiotics, and make sure that you're taking care of your gut health well with the wholesome food, having some fibers along with it, doing some fermented foods. Second point here. Now, for an example, you are doing some painkillers, anti-inflammatory, or you have to take some strong medications. Maybe some autoimmune patients are also on certain medications, and even your gut brain axis when you are on when somebody is on a antidepressant medications. Now these medicines actually inhibit certain secretions of the enzymes, and sometimes because of that your gut health is always compromised. There is some kind of a pain or a nausea or not feeling good or feeling bloated all the time. Now these symptoms means that somewhere these gut microbiomes are getting disturbed because of the medications what you are taking for your autoimmune condition, for your maybe skin, for your other infections in the body. Okay, so these medicines you take it for the short time, but later your gut becomes totally disrupted, where the microbiomes are the lining is become compromised. So you have to focus on the gut health. You have to make sure that your gut microbiomes become better. Now when we talk about solution, functional ayurvedic solution would be making sure that the herbs which I mentioned earlier should be taken, and if required some probiotics should be taken along with it. Make sure that you are taking the consultation of some expert, some doctor, where they can identify that whether the barrier is broken. Maybe there are some leaky gut symptoms, whether there are SIBO or CFO kind of symptoms, or maybe some IBS symptoms, and according to the symptoms maybe your gut lining needs some nourishment. It would be the nourishment in terms of the micronutrients, it can be the nourishment in terms of whole foods, probiotics, and gut friendly anti-inflammatory foods and herbs which are required there. So this is a very important a concept of gut microbiomes which should be addressed. So you should not sit on it, you should not just identify, but even take action. And when you take the action, which is the combination of Ayurveda and functional medicine, it becomes kind of a holistic approach. And this is how you are always conscious, aware that how your gut is behaving, how your digestion is behaving. So when we say gut is behaving, I'm talking about the microbiomes there. And this is where you see the long-term results, you see the prevention of any kind of flare-ups or any kind of other chronic disorders when the gut is taken care of well. So next time, whenever you think of your hunger, your digestion, make sure that there are 38 trillions of workers, an ecosystem which is already present in your gut, and that is working for you. So respect them, take care of them. If you take care of them well, they are going to take care of all the axis pathways in the body: gut brain axis, gut skin axis, gut liver axis, gut hormone axis, and gut immune axis. So everything is related with these gut microbiomes and the Agni, the digestion. So I hope you have understood the concept. I have explained it in a very simple language. If you have any more questions, please put it in the comments and I will be happy to answer you there. Take care, stay blessed.